Good afternoon, sir. Happy Guru Purnima.
Thank you. Thank you very much.
So, viewers, to all of you, also happy Guru Purnima. And it's been a pleasure and pure joy, sir, to be in conversation with you on this auspicious day. And for the audience, we would like them to know that I'm in conversation with my mentor. He's the maverick Dr. Rajiv Jerajani. He's been my confidant and the person who's got me to this level that I am highly humbled to be interviewing you, sir. Thank you for this opportunity.
My pleasure. Yes.
Uh, the audience should also know, sir, how you have led us, me and Anatta, in this incomparable journey. And we are striving to go forever ahead and ahead.
Sure.
So, ready, sir, for the conversations?
Here we go.
The current scenario of COVID-19, whatever is happening around, everybody has the knowledge. You and I keep getting phone calls too, some common phone calls. So here I would like you to help me and understand, sir, are these people actually depressed or they are just feeling low energy?
The question is very interesting because to feel upset or depressed is human nature.
Mm-hmm.
The current circumstances, as you described, is pandemic. It is not only in our country, but all over the world. And everybody is uncomfortable. Everybody, primarily because they do not know much detail about, since this is a new virus. This is a new virus. It's not that new viruses are not found, but this one has been found. But comparatively, it has become pandemic, means to spread all over the world.
Mm-hmm.
As yet, in last about 4 months, there has not been any medicine or vaccine that can be said to be, curative. No, there is none. Now, more and more research is being done on a fast track. People are working on this part of the story. But as yet, still, in last 3 months, there was a great deal of uncertainty. As projected, now technology is advanced and the communication all over the world has become very easy. I mean, I'm talking to so many people. So the information started, and some informations which were significant is the number of patients. And number of patients, how many got they infected, how many of them developed crisis situation where the respiratory systems were in trouble, and how many of them had death. Now, by default, this is a stressful circumstances for everyone because of that uncertainty. So, it is reaction to the circumstances. And this is part of human nature that everybody experiences. See, today, if I ask question, how many of you have never felt depressed? Nobody is going to raise their hand because we all feel depressed sometime or another. However, when we say depressed in terms of clinical diagnosis, it has a distinct criteria. This being a reaction to the circumstances, well, I would not say that this is depression, but it's a dysphoric mood. Everybody is worried, everybody is anxious, everybody is depressed because we are helpless. The feeling of that we are doing the best we can. So I would not call any person who is calling his anxiety is justified, but to what extent? How much? How long? How many times? See, if the person remains continuously depressed or anxious, well, he needs help. But I would not still put a clinical diagnosis of that this person is suffering with major depressive disorder. No, I won't.
Can we elaborate clinical depression versus perceived depression?
Now, let me tell you, depression in itself is an illness which is classified in number of different diagnostic criteria. The point is that it has an intensity issues, as I said, duration issues, and the severity index. So the point is that if it is sufficiently strong enough
Mhm.
to cause impairment of personal, interpersonal, social, and spiritual life, then yes, we would say that he is suffering with an illness. The point is that how do we know? How do we diagnose? Or what are the criteria? What we can say the patient is depressed. Now, in most of the depressions, it begins with loss of interest. Loss of interest in all or almost all activities.
Okay.
Then, obviously, a person who has lived a life which is active earlier and suddenly something happened and he started feeling this, he will start feeling helpless. He will start feeling irritable. This feeling of worthlessness comes, negativity creeps in, the sleep is impaired, the appetite is impaired, relating with people disturbed. So overall, the impairment of day-to-day life activity where person is not productive and he kind of loses complete interest. The person is refusing to get out of his room or refusing to get out of his bed. This is one aspect. Another aspect is that which I consider a very, very significant is there are two types of people who respond differently. You know, people, those who feel that, oh my God, such a miserable life, I don't want to live this miserable life. That is one category. And the other categories are those who are saying, I want to die. Now, both these parts, clinically, as a professionally qualified person, I would not neglect.
Yeah.
Now, unfortunately, depression is supposed to be a common word which is mostly misused in terms of psychiatry. You know, people, family members, general, people at large, any kind of mental disturbances are there, they will say the patient is depressed.
Hmm.
Not necessarily. So there are a lot of other mental illnesses which can be possible, which are presenting as. So the fact still remains that if depression is genuine in terms of due to an illness, yes, this person needs help. And as I said, loss of interest in all, sense of worthlessness, disturb, psychology and physiology functioning. Then yes, it is depression. But more than often, as I said to begin with, that everybody feels depressed. And when they feel depressed, what would they do? Either they will reach out for the help or the family members will do something about it if they are caring and sensitive to what is happening to this person. So what they will do, they will go to somebody, either a senior member in the family or somebody whom they trust or a doctor, a family physician. And what will the patient say? He will say, sir, I have difficulty in sleep. I don't feel like doing anything. I'm getting bored. I'm not allowed to go out. And I'm feeling hopeless about the situation. Now, under these circumstances, those who are not professionally qualified for this specific function, then label is put. He is depressed because they don't have time to check out the history for sufficiently long, how long. It should be minimum for a period of 15 days, 1 month. Then you can even think about it, not otherwise. So what happens is that these people go to the doctor. Let us take example general practitioner. He goes and says all these symptoms. He will say, "Are you feeling depressed?" And the patient says, "Yes." So by default, they write a prescription because they come from a genuine good feeling that no, patient should not suffer. So they will give medicine. They will sleep. Nahi aata hai, sleep medicine. He is depressed. Some antidepressants will be prescribed. Now it reinforces the thought process of the patient that yes, there is something wrong with him.
Mm-hmm.
Because I went to the doctor and doctor said that you have to take this medicine. If I have to take medicine, that means I'm not well. Now there is another group of patients, let me tell you, that they go out for a party and usually we all go through ups and downs. We always feel that, depression, sometimes good mood, sometimes not so good mood. So we went out in a social gathering and I was very quiet, silent, not paying attention. And my friend comes and asks me this question. Hari, what is wrong with you? Why you are not yourself? So it so happens that next question, next friend will say, are you depressed?
Mm.
Now, the intelligence is not lost. But he says, oh my God, other people think I'm depressed. So I might as well check out what is depression.
Mm-hmm.
And as I said, technology is available everywhere. So he will refer Google or Wikipedia or something like that. And he will read that you feel hopeless. Yes, I feel hopeless. I have lost interest. Yes. You get no sleep. Yes. So he makes a diagnosis for himself that I'm depressed.
What happens when the external but negative influencers are the one who are closest to you?
Of course, trust me, it is only those with whom you fight, whom you love. You don't fight with a stranger unless there is a reason. So the question still is that, of course, to expect that the other person is going to do exactly the way you expect that person to do, it may not happen. And therefore, if there is a difference of opinion, there will be some arguments which will be followed by anger, which will be followed by depression. And trust me, men, women have got different perceptions. So if the loved one, where I feel what is the kind of I'm doing everything for you. This is what the argument is all about. But you are not doing anything that I want. You're doing 100 things for me, yes, but what I want. And this I put in category of, addictive logic. Wherein when I don't, I want what I want. If I want it my way, if I don't get it, I'm angry. I don't express anger, and the anger goes in. And then I start blaming myself for everything that has happened. All negativity creeps in. So this is known.
Mm.
The answer to this question is that if you learn to focus on yourself, if you get to know yourself what is happening with you when you're getting angry or depressed, and if you are sensitive to the other person, the best thing to do, stop an argument is to say yes and stop the argument. There is nothing wrong if your loved one is saying something because it is out of love, affection, empathy, compassion, that kind of good feelings. How much am I? Why should I do it? This question comes when me and mine. That's where the fight starts. So the question still is that should we not label these people as depressed? No, that is reaction to the circumstance.
You use the word labeling. So when a person with genuine reasons would go to a doctor, seek help, why does he get labeled? Why does this labeling happen, sir?
See, this is not only for depression, let me tell you.
Yeah,
It,
other issues also.
yeah, all other mental illnesses, whether it is, related to the nature of the person or, moods of the person, thinking processes everywhere. When the person is labeled or when they say that they are mentally ill, I look at it in terms of psychiatry. When you are not well, that means I am presuming I am well.
Mhm.
Again, is not right. Simple. So, what the question still is that if there is an argument between the two, then there is a dichotomy. Now, this dichotomy in itself also exists in social circumstances. Most of the time, if the patient, is unpredictable, the other people are afraid. And when they are afraid, they would want to do discrimination. I don't want to deal with that. Oh, trust me, we as psychiatrists have this issue that I can't give my card and tell you to someone that कुछ problem आएगा तो आ जाना. It becomes difficult. And the next reaction that person says, no, I'm not mad. The whole concept of mental illness, unfortunately, it has been labeled that all these people are mad. And mad means they are out of community, out of society, and things like that. And that gives these kind of labels, which is not very happy situation. Yes.
That stops a lot of people with genuine reason to visit doctors also.
Oh yes, of course. But things are better. Of late, in last 5 to 10 years, I would say that yes, people are seeking help. Now they are open and willing to talk about their personal issues.
I agree.
Earlier, mad means he is outcasted, simple. And people are afraid. अगर लड़की को प्रॉब्लम हो गया उसकी शादी नहीं होगी वगैरह वगैरह. All these social problems also pop up. So the question still remains that yes, discrimination is there. Things are improving, but it may not improve the way I want it.
Depression can get misdiagnosed, like similar to other mental issues, anxiety, OCD, any kind of shift can get misdiagnosed. What would you like to share?
Yes, it can be. The question is, let's take example OCD or obsessive compulsive disorders. Do you think that we all have certain amount of obsession, certain amount of compulsion? We do have. Like if I lock this drawer, I hear the click of the lock, and still I would pull and check whether it is properly locked or not. How many times it happens that when we go out, lock the door and say, oh shit, I forgot the fan is on. And you come down, open, come down, check, and you have already closed the fan. Now, this is normal. I would not put this as an illness.
Mhm.
Discrimination still is there because the behavior pattern. Look, unfortunately, the psychiatry is based on statistics, the social perceptions. There are people who have individual perception concept, individual psychiatry, it's a school of thought. And the other is that out of 10 people, if 9 people are behaving and one person is not behaving, that one person is bad, mad, or something.
Mhm.
But my question to you is that how would you say and put a label there? That person may be a unique person. He may not be, sort of abnormal. I would not put it into that category. But people discriminate. When do they do that? When there is an excessive severity index is high, intensity is high, and duration is long. So
Mhm.
when I see that, yes, these are the criteria for me to say that, okay, there is a problem. Let's look at it.
Mhm.
And then to keep a diagnosis in 5 minutes, meeting the patient, not bothered to listen because I don't have time, or I do go by what the patient's relative will say. Well, these are the results
Mhm.
where the false diagnosis takes place. To know the patient, it takes time. You need to pay attention. Everybody wants somebody to talk to.
Mm. There
Yes.
is Mr. Samir Chand. He said,
Yes.
"Hello, Dr. Jerajani. I have an anxiety issue since years, and it mostly comes up when I'm unwell. I feel I should get well as early as possible. Also, I'm usually unwell cause of anxiety issues, which causes acidity and acid reflux. So it's a
Absolutely.
catch-22 situation. How does one get out of this?" And sir, I'll add one more question, which is similar. I just read it. Mr. Yogesh Kamath again says, does
Mm.
not want to get out of bed. Is it due to accident or physical trauma? Is it anxiety, the
See,
don't wish, the low energy feeling?
which is that's what I'm coming to. I'll explain this both. See, anxiety by default is human nature.
Mm-hmm.
All right, everybody gets anxious. If he doesn't get anxious, I'm surprised. The point is that how much, how long, and how often. That is the question. Now, Samir has described it very beautifully, and he is proving my point. Two things which he said. That one, that I want to get well, and since I'm not getting well, I'm getting anxious. Isn't it? So it's a vicious cycle. His questions are two, that I'm getting acidity. And see, acidity can be because of anxiety states. Yes, I agree with you. But in all probability, it is because of the medicines which you take. And there are some medicines, even in antidepressant medicine or anti-anxiety medication, there are some which would cause gastritis. So it has to be advised by a professional person with instructions how much medicines depending on the long, you have given me only one or two, questions which he is feeling. But in totality picture, when we see it, then we should be able to find out the cause of. I agree that anxiety will cause gastritis and gastritis is causing anxiety. That's why catch 22. But not only that, he mentioned that I'm getting anxious about my anxiety,
Mm-hmm.
which is what we call second order disorder. It is like you telling me that I'm getting depressed about my depression. Uh-uh. Then it increases your severity index. And therefore, the question which he asked, how do we deal? Both sides. You manage the acidity issues and gastritis part, whatever required, you take it to reduce that symptom so that anxiety will go or at least reduce. So you have to deal with the bodily symptoms which you have and the conflict or the reason to get anxious part.
Mm-hmm.
The fear which he is experiencing is of suffering. So the question is that handle both the circumstances simultaneously, seek professional help, understand why are you getting anxious, and even if you have a generalized anxiety disorder and medications are indicated, then the minimum amount of medications should be tried after trying out all the corrective measures if he can. And that would help you.
Mm-hmm.
Definitely it will help.
This is from Neelam Ramchandani.
Hmm.
And being mostly sad, gloomy, cheerless, we also call depression.
Again, I'm repeating, I might sound repetitive. See, all of us sometimes feel sad.
Mm-hmm.
I have seen that the diagnosis of depression is made because the person was watching a TV and there was some emotional scene and the person started crying. It happens to very many people. See, today, if you go by statistics, the global figure is extremely high.
Mm.
Depression and anxiety are two situations which are massive, massive. And unfortunately, or fortunately, whichever way you say, that there is medicine available for all illnesses. If you are not hungry, then I'll give you medicine, you will feel hungry. If you are eating too much, I'll give you medicine to reduce. नींद नहीं आता है medicine for sleep. You want to keep awake, medicine to keep awake. Medicines are available all over all the time. But will that solve the problem? Long term? May not. If it is required, yes. But if it is not, then I would not want to give medicine. Yes.
In your experience, I'm sure you must have met people who depend a lot on Google as doctor. What are the dangers when people follow Google doctor?
The question is, look, Google is information, right? Even small children today log into YouTube to watch the cartoons. Hello. The technology has advanced very well. The point is that if you are reading, whatever you are reading, it has to be from reliable source. If a non-medical website is giving you information which is based on no evidence, I would not go by that. See, Google in a way has been, I mean, any search engine, why Google? Today you have got 20 different kinds of, you know. The point is that if it is giving information, that information has to be changed into knowledge. But if you start seeing the patient who is little anxious, he will say, "नहीं नहीं ये तो मेरे को होता है." But then my question to you is that look, okay, I might sound cynical or joking, but a man doesn't feel if he's seeing about pregnancy that he gets pregnant. No. So whatever symptoms are being developed, if I feel that I have the symptoms, then I start making diagnosis for myself. I call it Dr. Google, Dr. Wikipedia. No. Please, I would request that no, don't go to absolute level. If you feel that you have got some symptoms, you must approach a professional system where you know that there are qualified people, reliable people, and the help is available. There is enough number of different variety of help sources. So it should be done. Instead of going to Google Doctor, I used to joke with my friends in college days that a new system had come that time for Diagnose. Diagnose is the name. So there is a symptom checklist. So the person sitting in the chair will give one form each to the patient and the family member. And he'll say, just tick mark. It's a computer generated paper.
Mm-hmm.
So he will take both the papers, put it in the computer, the algorithms will diagnose what is the probable diagnosis. And then you take out that paper and put in the computer and it tells you what the medicine to be taken.
For a human being?
It can be. So whether we should look at that kind of computer psychiatry, I would not. I'm still an old timer, still believe in mind.
Perceived depression is most common with people with addiction. How do you manage them?
Well, it is almost 35, 40 years that I have been helping people which are suffering with addiction. Like same answer which I gave, that it's a catch-22 situation. That do I treat addiction first or do I treat depression first?
Mm-hmm.
The addictive logic is based on addictive personality, where they say, I want what I want. I want it my way, and if it doesn't happen, then I throw a tantrum. The question is that because of that whole thought process, he doesn't get everything the way he wants, absolutely. So, therefore, it starts with look, nobody cares for me. The anger which develops because other people are not cooperative, whether the family members or other significant people, when they are not cooperative, he starts getting angry. And when he gets angry, he doesn't express that anger, it goes as a depression. You know, people have tendency, like example I'll give you, the people with drug addiction. You know, earlier we used to see only alcoholics or only heroin addicts or only, in today's time we start seeing everything. The fellow has got polydrug abuse. So when he is using the the medicines that would stimulate him uppers, then he will be hyper. And then when he takes a medicine which puts him down, then it is what we call lowers. So he becomes slow, sluggish, he is not reacting. So one is psychomotor acceleration, another is psychomotor retardation. So the point is, it does not make them bipolar disorders. Are you trying to understand what I'm telling you? All of you think that it's very easy to label a person bipolar. No. The actual taking a history for sufficiently long enough and making a diagnosis would be advisable. Yes.
We've seen numerous clients, they are misdiagnosed with various mental health ailments. How do we differentiate when they come and they feel genuinely they must be suffering this and we can't taper their medication? And we want to make them understand and even jot it out the real from the false or the wrong.
That's right.
How do we manage? This is for the viewers to know how do we manage to help the client
You see,
understand.
the question is the Anatta. I agree, 16 years. It's a different model than the popular medical or biochemical models. We are more on the psychosocial and spiritual aspects of life. In fact, when we designed, we said it alternative life skills training, where the person is learning.
Mhm.
The question is, as you rightly said, the patient is afraid to stop. Patient is afraid to stop the medicines, and the family members also are afraid. Then one part of the patient wants to stop, and there is a lot of confusion. So the point is that whether this is genuinely required or not required, and if required, how much is required is also the question. So it's not one day. It's not that I see the patient and I say, no, this is not is to be done, this is not to be done. No, I don't do that. The point is, patient is coming to Anatta with or without addiction. If the person has to be understood, it is necessary to interact with the person, to relate with him, to find out, give some alternative. So that's what we do. That here in in-house system, residential program, the patient does not have any other responsibility. The only responsibility is that of himself or herself. And they follow the instructions vis-a-vis voluntary patients, ambulatory patients. These are the patients which will come to us. And then it so happens that the focus of treatment primarily is on meditation, emotional writing, stress free life. This is what we do. And it is over a period of time after relating with the patient that we start reduction of the medicine, which is gradually to be reduced.
can you tell the viewers, guide them through the residential program that we would be doing at Anatta Retreat? It's our new
Yes, this
initiative.
is after working for 15, 16 years in one subject and getting reasonably good results. Though the highlight of our treatment module is the client specificity. It is not a label. It is the treatment methods are designed for that client and his discomforts and comforts level. The alternate life treatment where the patient comes and stays, it's called retreat. It is not called rehabilitation. It is called retreat. And the fact still remains that there is everything is provided for, and he is in counseling, which is 24/7, literally.
Mhm.
It is not the formal, it is very unstructured program wherein the counseling can begin in the morning breakfast table, where the counselor, in-house counselor, and the patient is sitting together and sharing a cup of tea. Plus, there are no rigid rules that you get up at 5 o'clock, sleep at 10 o'clock, that kind of restrictions are not. Once the patient is reasonably well, then all other activities which are jointly together, all of them, the staff as well as the patients, we don't discriminate. And therefore, what happens is that Friday evening, somebody gets a mood where he says, let's go for a movie. And suddenly a whole lot of people will go for a movie. It's okay. But it is giving, what I call conducive environment to the patient. The patient, unless he's calm, relaxed, and better, he is not going to think. I always give this example that you teach mathematics to the child who is crying, it will not happen. So unless the child is comfortable and is willing, then you will be able to give that kind of training. So we don't call it treatment, we call it training. But people come, they come, stay. Another important problem, issue is that we don't take too many patients. In the residential care, not more than 5 in one capacity. Especially since it is related to, earlier it was related with the substances. Now, if we are looking at another retreat which would help people with anxiety and or depression, then it will be at the most 5 or 10, not more than 10. The point is that Anatta has grown over a period of time with reasonably good, responses and improvement of the patient. We thought that we should extend our help. We should extend our helping hand to other people who are mentally disturbed.
Mhm.
But grossly psychiatrically abnormal patients, we have our limitations because it's not a medical facility, though there is in-house doctor available, panel of experts available all the time. But it's not a medical facility, it's a retreat. Anybody who wants to, look at one's own self, understand one's own self, and feels there is a need to make a change, then we are there to help you. Simple.
Yes, sir. So well answered. Thank you. So there's an anonymous attendee who has a question. What if you do all possible remedies for the person who's suffering from depression, anxiety, and mood swing? Still, he is not ready to make a move, some or make some positive changes in his life. Is somewhere diagnosing the problem that is lacking, or that person is habitual with depression, depressive nature?
It's a very interesting question, which is whoever the gentleman asked. Is he addicted to depression? Is that the question? No, I wouldn't put it that way. By default, we human beings are all hedonistic, pleasure-loving people. Depression, by and large, unless there is certain amount of environmental factors, certain, I put it that there are predispositions, there are precipitating factors, and there are perpetuating factors.
Mhm.
If all three, look, it takes time to make a diagnosis. If all three are conducive to be, and if the help, look, I give you help. If you don't want, I have seen this number of times. You write a prescription of one medicine bedtime to be taken for next 15 days, and the patient doesn't take it. So when it is a relationship between patient and the therapist, it is responsibility of both. More often than not, I instruct the family members also who are 24/7 staying with them. Or trust me, when we deal with addiction patient, the wife or the parents have to go through their own kind of codependency program. Likewise, even in mental health issues, anxiety or depression, whichever, there are going to be a number of different presentations. The anxiety can come with panic attack also.
Mm.
Can happen. It can present as a phobic anxiety also. It can be conversive disorder, obsessive. Primarily, I am making a broad classification. Anxiety related means the thought related and mood related. Depression primarily is mood.
Mm.
Help has to be there. And with the limited information, I don't take liberty to make any diagnosis. Whether the patient is responsible or the doctor is responsible or family members are responsible, I am like Mullah Nasruddin. I don't take decision. I ask a question for a question. Those who are meditators, there is a lot of research which has been done that the internal chemical environment within the brain, which is created by the artificial means of external medication, with training, it can happen with meditation. Everybody is talking about dopamine, serotonin, endorphin, all kinds of neurotransmitter. I'm not challenging them. Great. I mean, you need medicine, that's an option which you're choosing. That's a school of thought which you're choosing. But there has been great amount of research where you can do it with meditation.
Mm.
With change of lifestyle, it is quite possible for you to develop yourself. See, meditation is also a tool, it's an instrument. What does it do? It helps you understand yourself better. It helps you to analyze your own self. It helps you to heal yourself also. And that is required. Everybody has got great deal of human healing capacity. Everyone. What? Provided you exercise, provided you know it. As I said, information has to go into knowledge. But you should also have knowledge of knowledge, which I call epistemology. Then when you are using that knowledge, you are helping. And I have seen enough number of patients. And the best part of treatment which we were looking at, that if the patient has got, say, use of stimulants,
Mhm.
and if I don't give him a kind of meditation which will utilize that energy, he will never be happy. He will not be motivated to work with. But therefore, we use different kinds of meditations. Today, I've seen many doctors like to prescribe different kind of antidepressants. Now, if I am not coming from that kind of biochemical rigid belief system, then I should be able to offer many kind of meditation. The healing process is important. How well the patient is improving, that is impression. That is important. And for that, Both the therapist, the patient, or a doctor, all of them are responsible. Family members are also, in our earlier program with Anatta, therapeutic team, this whole concept is there. There's 24/7 counselors available, 24/7 doctors available. There are a variety of different kinds of therapies which work, whether it is practicing meditation, doing Tai Chi, or doing regression, all kinds of alternative lifestyles which we train. It is learning to be productive, learning to be sensitive to yourself and others. And that's what life is beautiful if you do these three things. I know myself well, I know yourself well, and I remain in present tense. God bless. Beautiful. And that's how this whole program is designed.
The questions are about when a person goes through a major family breakup, like a divorce, and it has impact on kids. How could we approach the kids in this situation? As I see, this lady is saying that her youngest daughter keeps talking about it, and it has mentally affected her the most. How could she deal with her
Oh, trust
kids
me.
now?
Just, just look at the paradigm from the child's perspective. Parenting means getting emotional support systems with the parents. Somebody to trust, somebody to have faith in that this person is never going to hurt me. Now, when the
Mhm.
child is witnessing the separation, oh, trust me, before separation, there are a lot of arguments. There are a lot of shouting matches which goes on.
Yeah.
And then it comes to that stage where divorce or separation takes place. The point is that if you both realize that the child is suffering, it is better not to argue in front of the child. But that also depends on how old is the child. The
Mhm.
younger, see, if the child is too small, he will not realize what is happening. If the child is grown up enough, then he will understand that, yeah, there is a problem. It is the in between group where is the problem. If the child is anywhere, say about 6 years to 12 years old, then the child feels vulnerable and afraid. He gets disturbed. And children are also very, very intelligent as of today. Trust me. What I would suggest is that look, if you, husband and wife, are not having, conducive relationship, but the common factor is the child, and therefore each one of them will have their independent relationship with the child. The fact still remains that if I say something against my spouse and this one is saying against the spouse, ये पापा की बेटी है और पापा का मम्मी का बेटा है वगैरह वगैरह, then it's a dysfunctional family. What is required is the child needs help by getting that sense of security, that vulnerability will reduce. I'm not saying it may disappear, but it will reduce. But the major aspect is that the husband and wife needs help. And I'm not
So,
blaming. Whatever the reasons may be, look, it's not that 100% you do what the other person says. But unless both of them take a decision to change for themselves and for the unity of the family, then yes, it can help.
hmm. Sir, another one is from Dr. Archana Harish. And how does one deal with midlife crisis situation, especially in females after childbirth and not able to come on track in their careers? What kind of words we use to counsel them who want to work but they are not able to join the rat race? Also, some people have lost jobs in lockdown, and how do they cope up? So basically, coping mechanisms that what we need to understand.
As I may repeat again that I have to learn to know myself. If I know myself means I am talking about my thoughts, emotions, attitudes, behaviors, perceptions, sensations, limitations, and postures. All. I should be aware of all these factors all the time. It's not easy. It's not going to happen in 2 days. It takes years at times to know yourself. Now you
Definitely.
are asking a question that if something is happening to that person, how you will respond. So you are saying that it is functioning of counselor or a therapist. I would say that it should be non-judgmental. It should be, compassionate, understanding, empathy should be there. And don't create dependency by taking decisions for the patient. It's as simple as that. Because otherwise, the patient develops codependency. You are becoming codependent and the patient is dependent on you, which is not a very happy situation. You should be aware of this part. In terms of, I do not know, Dr. Archana, but it is also coming from the way you're thinking. If you're coming from allopathy point of view, the perspective are different. Ayurvedic point of view, perspective are different. Homeopathy, perspective are different. It's all different school of thought. The modern medicine or allopathy, they have excellent medicine in crisis. They have excellent surgical interventions in crisis. They have superlative medicines for long-term, non-curable diseases where the life can be improved. Homeopathy, it's a philosophy, it's the organon, it's understanding the concept of totality. It is not only the person, it is the environment, the medicine, the effect of medicine on everything counts. Different people, even in homeopathy, there are schools of thought. Ayurveda is an ancient, literature. It is there. It's a Veda. Ayur means the life. Ayu, the length of life. And how to improve is given. But depending on what school of thoughts you are practicing, you will create your own interventions. See, modern medicine people will say something different, allopathy will say different, homeopathy will say that you don't take my medicines if you want to take my medicine. It doesn't work. As philosophy, all of them are great. All of them are great. But it is depends on those who practice what they do. Unless it is with the compassion, unless it is with, empathy to the patient. And one therapist has to have the patience.
Yes.
Good here.
So,
That,
so well. Neelam Ramchandani again. She's asking, do teenagers undergo depression? What are the immediate symptoms for parents, sorry, what are the immediate symptoms for parents to notice that that teenager is going through depression in order to seek corrective help?
a young grandchild went through a difficult breakup, relationship breakup. Obviously, the child is going to be depressed at least for some time. Why is she getting depressed? Because she did not get what she wanted. Why is she blaming herself? Because she can't blame him. The question is that everybody, the principles are same. The question is, if you want to make a diagnosis of depression, I said very simple. See, patient doesn't come and say that I'm depressed. Patient comes and says, I'm feeling not well, I'm feeling tired, I don't want to do anything, I don't eat properly, I don't sleep properly. Variety of symptomatology it will come. Like example, in homeopathy, they are called rubrics. In allopathy, they are called the patient gives symptoms. So the patient will come and say these things, and that should be like example. If you are a grandmother or a mother who is overprotective, and the child tells you to get out of my room and stay out, then what will you do? Because the child is wanting to me time. Nowadays, it is still there. People talk about it. They don't want to do what the parents. Everybody goes through these phases. The phase one, my parents, they are the best. Then they grow up, they learn their own experiences, and they say, "Buddha ko kuch samajhta nahi." The parents don't understand. This is what the children think. And then when they become parents and then when they retire, they'll say, "No, what my father used to say was right." So this everybody goes through. And as far as mother and grandmother are concerned, I would request you don't be overprotective, being vigilant and aware that something is happening. Don't force that child or don't make compulsions which she does not want. Or allow that grief period. You offer help. Say, Beta, if you really want to talk about something, I'm there. You can talk to me. Now that doesn't happen overnight. It is overall process in terms of relationship, wherein the child develops that kind of relationship with the parent. How often you have seen that mother is the one who stays home and is doing, therefore the child talks to mother, mother talks to father. What about relationship between father and the child? So it's a unit. It's father, mother, child, parents, parents ke parents, depending on the kind of family which they have. So one has to have a broader perspective. There are no ready-made answers. You have to talk to the patient, find out, develop that rapport, communication. If you can't identify what the emotional conflict is, how are you going to help them to solve it?
This is from Dr. Nandita Rane. Is it advisable to give a clinically diagnosed depression patient notes on medical depression that tell him about technical details about the disease? Will that knowledge help him or scare him?
Both. It can happen on either way. And don't underestimate today's patients. Try and understand, unless it's a grossly psychotic disorder, you are not going to see those patients. The point is, if the patient comes and you feel it is depression, well, if you want to give any literature on the subject, give something which is well researched, published, and from the authentic website. If you have a book, so that promotional books and motivators and all that, trust me, all of us have gone through that. Self-help, motivation, speeches, slogans, all said and done. But on that client, what will work is $1 million question. As you are asking, will it help or harm? Either way, you don't know. So give little, wait, give little more, wait, and then assess the situation, see the results of what has happened. If the patient is, there's nothing wrong with intelligence. If the patient goes through that and comes back and asks you a question, answer of which even if you don't know, don't feel uncomfortable. Say, I will look up and come back to you. It's okay to do that. It's absolutely all right to do that. But there is no absolute answer which patient will respond which way. It's difficult.
Sir, we've seen in our own functionality solutions evolve, and each
Yes.
person, each individual is so different from the other. So as we develop or we counsel, we come to a particular track with the person, and the solution is comes in front of
Itself it will happen. Yes.
yes, comes in front of them. It comes in front of us two together.
Absolutely.
This is from Mr. Harish Nair. Is depression hereditary? Does it run in the family? So we can connect this with the other mental issues also. So are these mental issues hereditary? Does it run in the family?
No, as I said, the genetic and familial research is done. And it says that yes, some of the traits are transferred into the next generations. They may skip a generation, but they do. You know, the memory of our ancestor is there within ourselves. We have evolved. Likewise, any illness, as I said earlier, there are predispositions. And considering like one parent has got a problem or two, the percentage vulnerability or risk factor increases if both of them are. Whether it is a combined family, nuclear family, joint family, staying together, arguments with husband and wife, there are number of parameters which will get affected. So as I said, that there is a concept of predisposition, the precipitation, and the perpetuation. There are reasons for all three. Now, to sit with the patient and understand. Like most of the time, the patient comes and says, I'm depressed because things are not working out. More than often, the patient comes, he is saying, I'm using drugs because my father is not behaving well with me. So, should I blame father? No. Should I blame the boy? No. Should I blame the drugs? No. So stop blaming others and look at yourself. What can you do for the patient with the best reason, beyond reasonable doubt? You should take care of it. Help the patient as much as you can. There are no ready-made answers.
Suggest any 3-4 tips on how to make people to stop talking casually about depression as a self-diagnosis, as most are perceived depression cases. So my simpler question will be that we should not use these words loosely, these terms loosely.
True, correct, absolutely. Don't use it. See, it is earlier the things were different. The mental health, Healthcare Act has come recently, 2 years ago. And the whole process of change of perception about mental health, it has already started. The conceptual framework which existed, say, maybe 10, 20 years ago was very different. And today, the legislation has improved, government conceptualization is improved, there is a mental health authority which is being developed. So all these things are happening, but it's not going to change overnight. It's a process. And the change of it may take a generation before it will happen. So, what is to be done? You do the best you can.
Any simple statement, any simple suggestion?
If you are fond of medicines, take it. If you are not comfortable with medicines, please give yourself a break. Take an alternative lifestyle, learning to be aware of one's own emotions. People only pay attention to the thoughts, they don't get in touch with their emotions. And 90% of them will end up in distressful circumstances. So, all I will say is based on my own school and my own philosophy. As I always say, Kshudha, Nidra, Karma, Sambandha, Shuddhi. These are 5 parameters. The food habits, the sleep patterns, the activity level, karma, relationship, sambandha, and shuddhi is cleansing. The physical cleansing, I take bath 5 times in a day. No, that's not the question. I wear new clothes, wash clothes, press clothes. No. What about here? This also requires healing. More you spend energies, well, you jolly well do something to heal yourself first. So that is what is required. And when do you feel joy and happiness? When you enjoy what you do.
Yes. Saida Tasneem is asking, what is your opinion about mindfulness in treating depression? Could you throw some light on how it would be helpful or not?
Oh, it is very good. Whether you are following one school or another, there is a school which is based on Hinian Buddhism, which then converted itself into three categories: Hinian, Mahayan, Vajrayan. That is Buddhist philosophy, which it initiated that part of the story, and subsequently to the Western world, it was called as mindfulness, meaningful. But
Mhm.
mindful of what? The method which they use is the meditative techniques. It is one of the meditative methods by which you become aware. They focus more on the concentration of breathing. That's where we start. There are a number of people who have taught this kind of meditation. There is adequate research that by practicing that, what we call long term meditators, they have amazing abilities which you may not be able to even imagine. It requires a lot of discipline, it requires a lot of training. The mindfulness, the concept is very beautiful. Very beautiful. If you are practicing, God bless you. What you need to do is to spread your knowledge on to others. Do that.
Mhm.
In one of the Pali Suttas, they say, Bhavatu Sarva Mangalam.
Mhm.
Like we say, na, medication to meditation. There is also passion to compassion. That it is not only me that I take help of myself to be myself, but when I'm well, I'm in a better situation to help others. And
Definitely, sir.
start doing that with compassion and enjoy it. Well, trust me, life will be different.
Sir Anand Pawar,
Huh.
what would you advise about persons with depression who are coming from transgender or different insecurities?
Oh, trust me, irrespective of sexual orientation or genetic constellation, whatever we call, there are people who I don't even use word homosexual or gays. I call same sex partner preference. The gender identity disorders are very common to get depressed because they are not accepted. The way you mentioned that any mental illness, they are discriminated against them, but they are human beings. They get all the same chemicals or social circumstances are different, but the individual relationship issue is same. They do get depressed. And why would I want to discriminate that person on the sexual identity? No. On sexual orientation? No.
Mhm.
Why would I do that? Emotional issues, whether in terms of relationship, it is there, it is there. It is there for any gender.
Right.
But unfortunately, the sexuality is subject there again. There is a social inhibition, social taboos. People don't want to talk about it. I'm happy this person has asked this question. I would say in Anatta, that is one issue which is paid attention to.
Yes, sir, very much.
Other places, I have not seen many.
Mhm.
That look, hang on, pause. The person has got an issue and he should feel comfortable with you to talk about his personal life. So, as a therapist, that is the idea. You are not going to give ready made solutions, no. But you are going to evolve into that solution. If you keep your focus only on problem, then you are redefining problem. But focus has to shift in terms of finding the solution. The conflict is there. Now, if it is solved, then you know and you will do something about it.
Mhm.
If you don't know, you don't know, and therefore you are not doing it. And that would result into taking pills, which doesn't have
Mhm.
much. I would put it that way.
Can you talk about the impact of stigma, prejudice, and discrimination in the mental health environment?
It is harmful to the patient for sure, but it's coming out of that fear, as I mentioned. Unless we make it as an inclusive kind of community where nobody is discriminated, well, I think it may take a long time. It's not going to happen so soon. I'll give you a concrete example.
Yeah.
Today, if there is a COVID patient,
Mhm.
how the people, if they know that this person has COVID, they will react to that. Same story. I'm afraid. Why I'm afraid? He will infect me. I'm afraid of suffering. So I take precaution to keep him at the social distancing.
Mhm.
Isn't it? But then, well, I might again sound cynical. But what happens to the doctor staff, therapists, nursing? What boys? They're doing it. They're doing it. The funny part of the story is that recently they requested all the doctors. So I said, yeah, I want to. He says, you're 65 plus, so I'm not allowing you to. What do we do? So then I started online training programs and things like that. That's what we do. Do the best you can. Enjoy what you do. Then life becomes meaningful. It's very beautiful.
So, as you have made us understand few concepts, there would be many more programs like this with you, sir, where we would generate as much information as we can and break certain myths, so that people come out, speak without prejudice, and are able to share what is exactly in their heart and head,
Absolutely.
and move towards a life where dependency is fewer, and they can lead a very fulfilling life. And if they need any counselor or they need a buddy, so that they are able to talk to them, communicate with what is happening to them exactly at that point, that is where you and I would like everybody to reach. So thank you so much, sir. On Guru Purnima Day, you've been part of our life and now part of the Zoom program. Thank you so much.
Incidentally, sorry to stop you, but today is Chandra Grahan. Do you know that one of the positions of the word lunatic has come from lunar? So today is the Buddha
Said
Purnima.
earlier.
It's supposed to be people getting affected mentally. No, please don't get worried about it. These are the different ways to think. Anyway, yeah. Thank you very much. I'll be helpful
Right
anytime.
now, you broke another myth. You just shared this with us, and some people who would think otherwise will now look into reading, getting more knowledge about this part of the story too.
That's great. That is wonderful. I'm happy I could be of some kind of help to someone.
Oh, always, sir. Always. Thank you
Okay.
for your guidance. Thank you.
My
Thank
pleasure.
you, viewers, to be part of this program. Thank